Okay, Matt, let's go ahead with the rest of our physical assessment. We're going to go ahead and do the eyes, ears, nose, mouth, and thorax. Okay, so the eyes, start with the eyebrows, are brown and thick, and they're symmetrical. They're superior to the outer outer canthus. The eyelashes are similar color and are upward and outward bending. The eyebrows match the rest of the hair on the body. There is no lid lag or ptosis. The sclera looks white with some vessels. The conjunctiva is pink and clear. The irids are blue bilaterally, and the pupils are round and equal. The papillary fissures are similar bilaterally and distinct. Okay, we're going to go ahead and I'm going to do some eye tests. Go ahead and fix your eyes behind me and open your eyes really wide, and I'm going to go ahead and shine my light in your eye. Okay, great, wonderful. Okay, if you can go ahead and focus on my pen light behind me. Okay, focus there, and then go ahead and focus right here, and then follow it to your nose. Okay, great. Okay, the eyes, the pupils are equal and reactive, round and reactive to light and accommodation, and this is bilaterally and consensually. Great. We're going to go ahead and do some visual acuity tests. The first one would be the Snellenberg's test, and that's where we test your far vision. And that is a chart that is 20 feet away, and a normal finding for that would be 20/20. And the smaller the fraction of that test is for vision. And then there is the Rosenbaum's test for near vision, and that's a card that's at 14 inches away. And a normal finding would be 14 out of 14. Okay. The next thing that we would test is your peripheral vision. So what I want you to do is cover your hand with your right eye, like this, okay? And this is the bunny, okay? And I want you to look into my eye, okay? And you tell me when you see the bunny, okay? And you just say now, okay?
No.
Sorry.
No, sorry.
Okay, let's try that again.
No.
Okay.
No. No.
Okay, great. And we would do that bilaterally as well. Okay, and then the next thing that I would check would be the cornea for cornea clarity. So if you could look straight behind me again, and I'm going to just take a look at the cornea, which looks clear there and clear there. Great. Next we would test for the extraocular movements. That's cranial nerve 3, 4, and 6. That is ocular motor, trochlear, and abducens. Okay. And the first one would be is the 6 positions of cardial gaze. So what I want you to do is keep your head straight and still, and I want you to follow my pen, okay, with your eyes. So follow up here, there, follow here, here, down there, and up there. Great. So there's no sustained diasthamus on that. The next thing would be the cover and uncover test. So I want you to go ahead and cover one eye with your right hand, cover your one eye, and, or uncover it, I'm sorry, and then focus on the cabinets back there. Then go ahead and cover it. And then I want you to take this eye and go look at the towel that is over there and fix your focus on that, and then uncover your eye. Okay, great. Looks good. That looks normal. And then I'm going to do the corneal light reflex. So just look at me, and I'm just going to see. And the reflex is equal. Wonderful. Okay, I'm going to go ahead and look inside your eye. This is where I turn the lights out, but for this we're going to keep them on. And I'm going to look for the red reflex. Keep your eyes nice and open. Okay. All right. Wonderful. And then I'm going to keep looking. I see the red reflex. Great. Wonderful. And I'm going to take a look. Okay. Wonderful. Awesome. Okay, so what I saw there was I saw the fundus, and it's a creamy yellow. And I see the optic disc. I see the arterioles and the venules. And arterioles are brighter than the venules. There's no nicking or crossing. If I follow the vessels nasally, I see the optic disc. And there's no physiological cupping or glaucomatous. I see no hemorrhaging. If I go temporally, I go to the macula, which is like a gray color, and I see the fovea centralis in the center, and that's the center of vision. And I see no hemorrhages at all there. Great. I also do not see any exudate outside the eyes there. Wonderful. Okay, we're going to go ahead and look at your ears. The helixes are symmetrical, and they're, go ahead with the eyebrows. There's good recoil on the helixes. I don't see any lesions at all. Is there any tenderness here?
No.
No? Oh, and can you close your eyes? Let me palpate for the any tenderness in here? No
No.
lacrimal duct or sac? Okay, forgot that. Okay, great. So I'm going to go ahead and look inside your ear. Can you face this way for me? Great. So, okay, and as I'm looking into the external auditory canal, I see some hair and some cerebrum, and I see my landmarks. I see my cone of light at 5 o'clock. That's in the right ear, and I also see my landmarks. I see the umbo, which yes, and the malleus, and I see the pars tanza down below and the pars flaccida above. The tympanic membrane looks like a pearly gray, and I see no bulging or redness there, or any foreign objects. Great. I'm going to go ahead and scan the room. Make sure there's no cheat sheets anywhere here. Okay, nothing there, nothing. Great. No, nothing on the ground. Wonderful. Okay. Okay. Okay, we're going to go ahead and look in the nose. On inspection, the skin looks the same as the rest of the skin of the face. The corneum is distinct and symmetrical in midline, same with the nares. Is there any tenderness when I touch your nose?
Nope.
Okay, great. I'm gonna go ahead and take a look here. Each nares looks equal bilaterally. The septum is intact and there's no perforations. I see the turbinate, the inferior one. I don't see the superior one. The mucosa is moist and there's no deviated septum there. Great. I'm going to go ahead and test the olfactory cranial nerve number 1. Can you just show me that your nares are open? Can you hold it and then breathe on each side? Okay. Have a little cold there, but we'll see how we do there. Okay, so go ahead and close your eyes and cover your left one will work. And can you tell me, can you sniff and you can tell me what you smell there?
Cinnamon.
Cinnamon. Okay, and can you cover the other? Keep your eyes closed. And tell me what you smell there.
Vinegar.
Okay.
Or silicone.
Silicone? Okay. Alright, so that's olfactory nerve number 1. Okay, so we're going to go ahead and do the mouth. There, the vernallia of the lips is well defined. The lips are red and moist and they are not chapped. Can you go ahead and smile for me? Okay, the teeth are white and clean. Okay, I'll go ahead and put my gloves on. I forgot the hearing test.
Stuff it.
Okay.
This.
Okay, so I'm going to go ahead and count the teeth. If you can open nice and wide for me. Open. Okay, I'm going to go ahead and count. Okay, we have 27 teeth. I see no fillings or cavities. Okay. Let me take a look inside the buccal mucosa. Okay, pick up a little bit. Okay, it looks pink. I see no ulcers or calcifications. Okay, so let me see the frenulum, superior frenulum is there, and the inferior, the sublingual. Can I take a look at frenulum? I'll look underneath. Okay, that's intact. I could palpate the Wharton's duct and the sternum's duct back there at the second molar. The gums are firm and pink. They're not bleeding or what's it called? Receding. Okay, yeah. Can you stick out your tongue for me? Okay, the tongue is pink laterally and well papillated on the outside. Let me take a feel here. The hard palate is well rugated and conjoined to the soft palate. Can you go ahead and say ah for me? Okay. So as he says ah, the uvula moves up and down midline, and the tonsils. There is no tonsils on you because you had a tonsillectomy. Yeah. Okay. And there's no ulcers or signs of infection there. Okay. So we just tested the hypoglossal nerve, cranial nerve number 12 with the tongue. And then there's cranial nerve number 9 and cranial number 10, glossopharyngeal and vagus, and that is for swallow, speech, and gag. Okay, I forgot to test the auditory cranial nerve number 8. So let's do those hearing tests. Okay. Okay, what I'm going to do first is the whisper test. Okay, and so can you include your ear here with one hand? And I'm going to go ahead and whisper something and you tell me what you're hearing.
Soccer, football, tennis. Oh, I missed the last
Let me
one.
do it again.
Soccer, football, soccer.
There you go.
Okay.
Yeah, and then I would do that bilaterally as well. Same with the looking inside the ear, I would do it bilaterally. And the cone of light on the left side would be at 7 o'clock, if I didn't say that. Okay, let's do the other hearing test. So I'm going to go ahead and put this on top of your head. And can you tell me if you hear it in both ears or just one ear? Okay. Both ears, okay. And I'm going to do the same thing, but I'm going to do it behind your ear here. And I want you to tell me when you stop hearing it, okay?
No.
Okay, still hear it? And tell me when you don't hear it anymore.
No.
Okay, wonderful. So that's showing that the air conduction is, in comparison to the bone conduction, is 2 to 1. Okay, great. Okay, we're going to go ahead and do the thorax. If you could take your shirt off, that'd be great. I'm going to go ahead and check to see. Oh, let me see if the camera's working. Yep, still working. Yay. Okay, so I'm going to go ahead and look at your anterior posterior diameter, which looks about half the size as the transverse diameter, so that's great. The skin on the thorax matches the rest of the body. There's hair distribution like a male pattern. There's some lesions in the form of macules in the subclavicular, superior right subclavicular region, and there's a few more macules in the abdomen area spread throughout. Okay, I'm going to go ahead and palpate. Is there any tenderness
No.
in here? Okay. I see some pulsations, but we will deal with that when we do listen to the heart. And there is no thrills or thrusts. Okay, great. All right, can you go ahead and face this way? And we are going to test thorax expansion. Okay, and I'm going to go to the 10th intercostal space. I want you to sit nice and tall for me. Okay, and then I want you to take a deep breath in and out. Okay, let's see. Deep breath in and then out. Now I need really big. Okay, let's do that. Okay, one more time. Okay, excellent. Okay, and then we're going to test the diaphragm excursion. I think that's what it's called. Yeah. So what I want you to do is take a deep breath in and hold it in. Okay, so deep breath in. Okay, great. All right. Okay, and then I want you to take a deep breath in, and then a deep breath out, and then hold it. Deep breath in, deep breath out, and hold it. Okay, great. And let me measure that. And that's normally 3 to 5, and it's about 3.5 centimeters, and that's that's normal. Okay, I'm gonna go ahead and percuss here. All right, great. I want you to go ahead as I touch you. I want you to say 99 really loud, okay?
99, 99, 99, 99, 99, 99.
Okay, great. So I hear those feel those vibrations orally, bilaterally. Okay, I'm gonna go ahead and auscultate the lungs. Just go ahead and breathe normally. Okay, can you put your head, your hands up over your head? Okay. Okay, so lung sounds are clear, and no bronchi or crackles or any abnormal sounds there. Okay, Matt, I want you to go ahead and lay down. Okay, great. I'm going to go ahead and take a listen to your lungs here. Okay, great. Now I'm going to take a listen to your heart sounds, and I'm going to listen to the bell and the diaphragm. So the first one I'm going to listen to is the aortic, and it's the second intercostal space, right sternal border.